Since I was diagnosed, I've had a fair few chest infections, probably several times a year, having to go into hospital for some of them because some of them are quite severe. I could say the symptoms I have every day would be coughing, obviously, really, that's the main thing. Depending on how my chest infection of the time is going, I might have pain, I might have breathlessness, I might have a reduction in the amount of exercise or the amount of walking that I can do. Sometimes when I'm not well at all, I can possibly make it to the shops around the corner, but possibly not. The treatments take about 2 to 3 hours a day, depending on how well I'm feeling, how long it takes me to clear my chest. If you add in things like having to have naps in the middle of the day, if I'm really exhausted, I can't go on any longer, having to see my GP, to go to hospital, to pick up prescriptions, to clean my nebulizer parts, to do all these various different things. A monthly average is a lot of time. My treatment regime affects my day-to-day life in various ways. I would say it's quite time-consuming. It's quite exhausting sometimes. I do a various amount of things every day. I would take medication, I would take tablets, I would take insulin and nebulizers and inhalers. So already there's quite a list. I also do physiotherapy either end of the day, which would take 2 to 3 hours in total, dependent on how my chest was at that point, how my chest infection was progressing. And the point of it is to clear my chest. So I have various aids that would enable me to do breathing exercises. It can be fairly boring, but I always feel a lot better when I've done everything that I should do. So I keep trying to do it. My medication and my equipment are quite portable, most of it. I can travel around quite easily, except one of my nebulizers is still quite an old nebulizer, so it's fairly large, and I use that at the moment every other month. So when I'm on the month that I use that, that would take up half a suitcase. So if I were going away for overnight, I would have to take a suitcase, which makes everybody think I'm just a typical girl that has lots and lots of makeup and lots of clothes, but it isn't, it's medication. So